A warm welcome to this edition of Infomed Lite. Infomed Lite is a program that takes medical information, simplifies it, breaks it down and packages it in a way everyone can understand. If you are a medical personnel and you are joining us, of course most of the stuff we'll be talking about here may seem too obvious to you. We just ask that you bear with us, be patient as we break down obvious information to our people who may not have medical knowledge. On today's program, we'll be discussing the post-COVID pandemic drug cabinet. Specifically, we'll be discussing 7 drugs that you must have in your drug cabinet going forward. Now, another reminder that the information we give on this channel is only for information and educational purposes only and should never be taken as a substitute to a professional medical advice. All diagnostic processes must be carried out in a doctor's office. The consensus seems to be building that COVID-19 cannot be stopped or eradicated. Thanks to Omicron variant, many policymakers around the world believe that it is time to move forward and live with the SARS-CoV-2 as a normal, frequent, infectious pathogen. We are transitioning from a pandemic situation to an endemic status of COVID-19. Now, pandemic means infectious disease from a common pathogen affecting people in different countries and or continents. Endemic means infectious disease of common pathogen source regularly found in people in a certain area. We will make a presentation very soon and we'll be discussing the difference between a pandemic, an epidemic, and an endemic. So watch out for that presentation. It will be coming very soon. So COVID-19 is going to be a recurrent infection in people, just like influenza during winter or influenza during exposure to cold weather or cold situation. This means that hospitals will have to be prepared for eventualities of having COVID patients, and the pharmacies must stock up on COVID medication, and your drug cabinet as well must have new items on a regular basis. So in this program today, we will highlight the medications that must be in your drug cabinet, or at least that you should be able to find in the hospital or your local pharmacies whenever you go down with endemic COVID-19. The list we are about to give you is based on 2 approaches of treating COVID-19. 1, immune system optimal function, and then 2, interference with the viral replication processes. Let us begin with immune system optimal function, or agents that will optimize your immune system. Some people call them immune boosters. We have broken them down in 3 categories, and category number 1 are vitamins, then we have minerals, and we have lifestyle and diet. Let us first of all address lifestyle and diet. At this point, we are assuming that you are not taking alcohol, and if you do, we are assuming or we expect that you get your drinking habit under control. Alcohol is a serious problem, especially if you are trying to optimize your immune system. We are also assuming that you don't smoke, and if you do, you are advised to stop smoking immediately. The list of damages occasioned by smoking, by the way, is longer than the wall of China. Smoking affects every known organ in your body, and this puts your immune system under serious pressure and may not perform when faced with pathogens such as SARS-CoV-2 or COVID-19. So please, let us be wise. You cannot be smoking and your car is smoking and your kitchen is smoking. One of you has to be the bigger person. The next point is that you should be serious and consistent in taking care of your comorbidities. What are comorbidities? These are concurrent diseases that you may be treating when having COVID-19. Let's mention a couple of them so that you have an example. We are talking about conditions like obesity or type 2 diabetes, metabolic obesity, kidney disease, liver disease, heart disease, asthma, chronic obstructive pulmonary disease, also known as COPD. By the way, COPD is one of the reasons people are advised to stop smoking, because one of the effects of smoking is COPD. Healthy eating habits is another thing that you have to take into consideration. Always eat a balanced meal. Cut down on your sugars and carbohydrates. Increase your vegetable and cereal intake. Eat red meat in moderation. The function of an immune boosting agent is to excite your immune system to perform well. Immune system means immune cells such as T cells and B cells. These cells fall under lymphocytes that play a role in identification and remembering foreign agents, and monocytes that play a big role in phagocytosis or destructions of pathogens. But also, immune system extends to the whole ecosystem of formation and deployment of these immune cells to the site of infection or inflammation. Let me give a warning here that after COVID-19, especially around 2020, the market has been flooded with products claiming to be immune boosters. I'm very sorry to inform you that most of these products are ineffective and straight up useless. Many of these products are pharmaceutically counterfeited, unapproved, and borderline harmful to your health. Always consult your pharmacist before taking or chugging any product or concoction which is marketed as an immune booster, because this may affect your health negatively. So after that brief course of immunology, let us talk about vitamins and minerals that you must have in order to fight the endemic COVID-19. Number one, let's talk about vitamin D. Vitamin D is a fat-soluble vitamin that has been known to help the body to absorb and retain calcium and phosphorus. Now, both those chemicals are critical for building bone structures. When we talk about bone structures, we are talking about the integrity and the strength of the bones. Rickets is a disease of the bones in children, and osteomalacia is a disease for people who have calcium or phosphorus deficiency when they are grown up. Osteomalacia simply means softening of the bones, which may result in brittle or breaking of the bones. In lab, studies have shown that vitamin D can reduce cancer cell growth, help control of infections and inflammation, and this is where the use of vitamin D to control infections such as COVID-19 comes in. So we know that vitamin D's main source is the sunlight, of course, and this is through your skin. Your skin will absorb the sun's ultraviolet rays and turns them into vitamin D3. There are also other subtypes of vitamin D available, such as vitamin D1, vitamin D2, and of course vitamin D3. They are all available in supplement form, but the most recommended is the naturally occurring vitamin D from sun rays, especially for people of darker skin. Now, this may sound unfair to black people, but this is nature. This is how we were created. Black people have a component called melanin in their skin, which causes the skin pigmentation to be black. That pigmentation causes the skin not to absorb sun rays adequately. For instance, that's why you don't see black people applying sunscreen whenever they go on the beach, unlike people of Caucasian origins. Those can absorb adequate amount of vitamin D. So if you're a black person out there, you need to make sure that you go under the sun at least 30 minutes every day so that you may have enough reserve of vitamin D. Moving on, number 2, we have to stock up on vitamin C. It is also known as ascorbic acid, and of course we know this thing has gained a lot of popularity during COVID-19 pandemic, but even before then it was being used during the flu seasons because it is one of the essential vitamins that must be consumed, especially in diet. It is not to boost or help in repairing immune system. It helps in the production of white blood cells, lymphocytes and phagocytes that protect the body against infections. It also protects immune cells from harmful molecules such as free radicals, also known as oxidants. So, intake of natural vitamin C or its supplement shortens the period of colds and flu. This is scientifically proven and reduces the severity of cold and flu symptoms. It is always good to remember that once you get these things naturally from food or diet, you get the best of them. Moving on, number 3, you must have zinc sulfate in your cabinet. Why? Zinc has a function in sustaining enzymatic functions, boosting immune system and of course replenishing zinc in zinc deficient patients. So I have to give a caveat here. Zinc should not be overused or abused because too much zinc reduces the level of copper in the body, and copper deficiency is equally very dangerous. Number 4, you must stock up on magnesium, or at least you should be able to access magnesium. Magnesium is a very powerful mineral in the body, especially for the body function during immunosuppressive infection. Magnesium aids in many enzymatic activities, protein synthesis, muscle and nerve function, regulation of biochemical reactions in the body, among many other functions. Magnesium is a very good mineral to have with you. In fact, I'm persuaded that we should have a session with a physiology expert to discuss vitamins and minerals and their functions in the future. Let's hope that is going to happen. We'll look in our circle and see if we can find someone who can discuss these things adequately. Number 5, you must have what we call oral antiseptics. Oral antiseptics, of course, most of us, we call them mouth washes or mouth gargles. So you are expected to have them and gargle them because they are useful in maintaining oral hygiene and in neutralizing germs. Example, you need things like chlorhexidine and cetrimide. You also need hydrogen peroxide, povidone, and iodine. These are very, very good oral antiseptics and we must have them. Number 6, this is a big one. You need to get access to Paxlovid. What is Paxlovid? This is a COVID pill manufactured by Pfizer and approved by FDA. It's a combination of 2 pharmaceutical products, nirmatrelvir and ritonavir. This drug works by inhibiting protease enzyme during the process of viral replication towards the end of the viral replication process. A video on pharmacology of Paxlovid is in the making, so let's not give so many spoilers here, but we'll be talking about Paxlovid very soon. Watch out for that video. At number 7, you have monoclonal antibodies. Now, monoclonal antibodies are isolated from your body and synthesized in the lab, and they are deployed through injection or IV infusion to boost your immune system. Every time a patient goes to the hospital and they have comorbidities and they are very immunosuppressed, usually they get an injection of monoclonal antibodies to help boost the antibody activity in the body. We will also discuss at length monoclonal antibodies, their function, and how they work during an infectious disease such as COVID-19. Lastly, we have not included this on the list because it's expected that every time we have COVID-19, as it's becoming endemic like the flu, we will be having COVID-19 vaccines every now and then. So the Moderna, the Pfizer vaccine, and all these other vaccines, this may not be going away anytime soon. They are going to be part of the system and they're going to be part of the protocol in treating COVID-19 as it becomes endemic. We thank you so much for taking time to tune in and watch this video on Infomed Lite. We appreciate your company. If you have a question, drop them in the comment section. And if you have a suggestion or probably you have a critique, also drop those in the comment section below. We will attend to each and every question you may have. But while you are at it, if you love the presentation that you have seen today, we ask you to give us a thumbs up, subscribe on this channel, and also share with your friends so that we can have knowledge on medical issues. We thank you so much for tuning in. See you in the next video.